legislature, us personally, and others fired up. My hypothesis is that for one reason or another, every one of us will be unhappy with some of the proposed changes. I virtually predict that 100 out of 100 in the House, 35 out of 35 in the Senate will be unhappy with at least one change that eventually gets proposed. So my thought is, if we can find a way that something that may be a negative to one group on the one side can be somewhat offset with a positive on the other, and that we all understand that we're one team trying to come up with the best outcome for all of Arkansas, even if there's some give and take in this thing, that we've got our best chance to get to the wonderful place that we're headed. So I just wanted to say that before any sparks start flying. Thank you.
Okay, Representative Farrar, you have a question, you recognize.
Thank you. It's a question of the chairman. I'm not getting this information until I get here in our chairs. Is there any way we can get this a week or three, at least 2 or 3 days before we present it here? Because I don't have a chance to read it here.
We haven't seen it either, and we can pass that to the Stephen Group when they, all the information that you have is what we have. If we get it, it's posted on the website, and some of this stuff I know they're working till the day or two before. I guess what I would tell you as the chair is when we have information, it will be posted on the website or emailed to you all directly, but there are going to be times when we don't have it till a day or two before, which is the case this meeting.
But there's no way that we could actually get maybe move the meeting back until we get the information. It would be to keep me more informed and actually ask some better questions if I can read the information before
we'll just
start going to present.
Yeah, we'll try to get the data to you as soon as possible. I don't want to start slipping meetings based on data because we just don't know when that's going to be. But again, we'll visit with our consultants, and anytime that they can get that to us a week in advance, which is, we'll try to set as a goal, we'll get that out. Because I certainly understand it's better if we have that stuff to study in advance because all of us are going to see, we're going to see slides here that I haven't seen before and nobody has seen before. And again, what I would encourage members, you know, you've got a notebook full of stuff here too, so you've got plenty of information to review through there and make sure you're up to speed. But yeah, some of it's not going to be as timely as we'd like. We'll do the best we can. Any other questions? First item on the agenda is the approve the minutes for May 28th meeting, which is Exhibit C. I have a motion to approve the minutes. Motion by Senator Bledsoe, seconded by. All right, we'll just already deadlocked on the minutes. Second by Senator April. All in favor, say aye. All right, minutes are approved. Thank you. Okay, item D is where we're at on the agenda. As you all probably read and saw, we have a contract referred to us, which is a contract with McKinsey & Company. And let me just make a couple comments in the co-chair. And while they're doing that, Mr. Seelig, if you come down to answer some questions about this. I think I said at the last task force meeting, we're not going to turn it into a contract review committee, and that's still our intention here. However, I also see the value in us having a good understanding of major contracts regarding healthcare that are being entered into with DHS or with the Insurance Marketplace Oversight Board or anybody else that has to do with healthcare. So while we're not really a review authority, and this everyone needs to understand, regardless of what this task force does, this will be decided tomorrow by Legislative Council. I do think there's some value in us at least understanding what this contract is and what it does. So what we're going to do here is ask Mr. Seelig to give an explanation of what this contract is. He's got a contract review specialist with him who are going to speak to that. And then if you have questions of either Mr. Seelig or Mr. Stephen, we'll be glad to hear those questions, and then we'll just make a determination about any action, if any action the task force will take. So, Mr. Seelig, why don't you go ahead and explain? You all see in item D there the terms of the contract, who it's with, and I guess Mr. Seelig, you're recognized to explain what it's about.
Thank you, Mr. Chairman. This is we appreciate the intent to talk about it because this work has been central to some of the work we've been doing to try to reform Medicaid over the last 3 or 4 years. This is an extension of a contract that we have with McKinsey & Company to do some of our reform work in Medicaid. Those of you who've been here a little while remember that we had a...
Okay, if I can interrupt for just 1 second. Sure. Members, you have an Exhibit D the request for the sole source procurement, and again, I don't think this is a 40-page contract or something. I don't think you have a copy of that, and again, we're not a contract review committee. But you do have the justification for the sole source, you have the basics of the contract there under item D on your agenda, and you have people here to explain it. And you want to say something?
Many people, I think, understand why we're doing this today, but just for those that may not have understand, I'm just going to try and share it as best as I understand it. Yet, earlier this week at an ALC meeting, there was a motion made that rather than ALC just move forward and approve this contract, that it be sent to us here in the Health Reform Task Force to be able to review and make a recommendation or share thoughts with ALC, and that this contract is on the ALC agenda for tomorrow for approval, but in advance of that, the motion was made for us to review it so we'd have the opportunity to weigh in and make a recommendation. That's my understanding of what we're doing here this morning and why this agenda item is on our agenda.
Okay, and I got a couple here for questions, but let's hear from Mr. Seelig, then let's hear from Mr. Steve, and then we'll go through all the questions at one time. So go ahead, John.
Thank you, Mr. Chairman. And just a little background on this. Those of you who have been here a few years know that we had, probably about 5 years ago, had a very serious multi-$100-million shortfall in Medicaid, and it looked like that was going to continue. At that time, the governor, and with a lot of legislative input, decided rather than do what often happens, which is you make deep cuts in who's on the program or the services they're able to get, or deep cuts in provider rates, or what many states did was simply hand the entire program to managed care companies to run it for them. The decision here was to move away from our fee-for-service system and really try to create better incentives for physicians and other providers to use evidence to coordinate care, to eliminate duplication, basically to take some of the inefficiency out of the system. We put together a plan to do that and worked with the federal government, told them we needed help to do it because the approach that we were taking with patient-centered medical homes and episodes of care was going to be very complicated. We were the first in the state to do it in the way we were, first in the country. And we got a $42 million federal grant for 3 years to assist with this work. But this work is so complicated, we didn't begin to have on our state staff in Medicaid, frankly, the firepower to do it, the people with the right skill sets and knowledge and experience to put this together. So we, working with the private sector, because this was to transform the whole healthcare system, not just Medicaid. So we sat down with Blue Cross and QualChoice and others and interviewed, I think, 4 of the top companies in this field. McKinsey was one. We also talked to Bain & Company, Optum Insight, and I think maybe Price Waterhouse, had them do proposals and did verbal interviews, and then we selected McKinsey out of that as clearly the best choice for us. And they have since then worked with us on designing these reforms to the Medicaid system. And the reforms are expensive, there's no doubt about it, and the work is expensive and McKinsey is expensive. We think we are seeing, based on literally what's happening to the Medicaid budget, we think we're seeing real changes to the healthcare system. As you all know, again, if you've been here, we were growing at 6 to 10% a year, probably averaging about 7% a year on Medicaid. And every percent that we grow in Medicaid at this point is about $50 million that we spend in state and federal money. So a 6% growth rate was having a huge impact. We were coming over here asking for $100 to $200 million more each year for Medicaid. Our goal with these changes was to get to 5% or below. We thought if we could even take 2% off, in the healthcare environment, that was pretty good given what was happening around the country. What we have seen in the last, I think for 3 years now, our growth rate has been between 1 and about 2.5%. Now, we don't credit all that by any means to the work we've done. Some of it is because of the economy, but we do seem to be trending even below other states. And obviously, it's had a tremendous impact on our budget. That difference between 2% growth rate and a 7% growth rate, just over 3 years, is about $1 billion in spending. So it's a huge impact. This contract would be an extension of the work that we're doing and the commitments we made to the federal government as part of getting that $42 million to continue these reforms. That said, the governor and the task force, when the task force was created, one of the goals of the task force is to look at the payment improvement work that we've been doing and say, is that the direction we need to keep going? Do we need to change it? Do we need to do some other things in addition to what we're doing? And our contract with McKinsey & Company allows us, if necessary, to change that work. And certainly, you know, we're going to do that. I mean, what we're going to do is work with the task force, work with the governor's office, and do what we need to do. Our concern about not going forward with this contract now is we would be, with the work that we've got underway, for example, with our patient-centered medical homes, we're getting close to being able to pay primary care physicians. What we did with primary care physicians is give them extra support and then said, if you can keep the cost of care for your patients down, kind of your total panel of patients, like if you have 1,000 Medicaid patients, if you can keep that cost of care down and still hit quality standards, we'll share that savings with you. And it's a way to really strengthen our primary care physicians, particularly in rural areas where it's hard to get them. So part of what McKinsey's doing now is working with us on how to make those payments, actually make the system changes to get those payments to work, to make sure we pay them appropriately and accurately. We have a few more episodes of care that we're working on, none of which have to do with primary care physicians, because we felt like the primary care physicians, we were already doing enough with them, so we're working in other areas. But my concern of not going forward is we would kind of come to a full stop on the reforms we're doing now before we have from the task force and the governor a plan of where we want to go next. And so our concern would be we'd like to keep this contract in place to keep the work going, knowing that if we need to, we can then change course based on the guidance from you all, the broader legislature, the Public Health Committee, and the governor. But we don't want to be in a position where we say to the federal government, and frankly our provider community, that we're just going to stop now and wait and see what happens. I think that federal grant would be at risk if we said we're simply going to stop and we might start something else in the future. I think we're in a much stronger position if we keep the work going and adjust as necessary, which could include, I mean, if you make recommendations prior to a full report in December that makes sense, then the governor wants to go forward. There's nothing that would keep us from making changes as we go with this contract. So, Mr. Chairman, I'll stop with that. I can take questions. I don't know if you want Mr. Stephen to come up.
Yeah, I want to hear from Mr. Stephen. And Don, do you have anything you want to say about it? Or state who you are for the record. If you want to add anything, and then we're going to have Mr. Stephen, then we've got 3 or 4 here wanting to ask questions.
Don, excuse me, Dawn Staley, Director of the Division of Medical Services, and I'll just wait if there's any questions that we need to address.
Okay, all right. Mr. Stephen and Martha, if you'd come down and introduce yourselves, and if you guys can kind of make a slot for them or get another chair or something. Again, when this got referred, I asked our consultants to take a look at this and give the task force some guidance about this contract. So they're going to speak to that, and then you'll have an opportunity to ask questions of any of them up there. So go ahead, John, you're recognized.
Thank you, Mr. Chair, members of the committee. Martha Tuttle from my team is being tasked to look at contracts and is, in my opinion, one of the best experts in contract management and contract issues, and will help you immensely as you go through becoming a more efficient organization down the road in contract management and how to really look at outcomes in the future. So I've asked Martha, based on what we heard yesterday, we were asked to look at this contract, and Martha has had the opportunity to meet with the agency and look in detail at the contract. And I also have had the opportunity to see some of the work in the payment improvement and episodes as well, so I can address some issues too.
Thank you. We have no qualms with McKinsey as a reputable.
Hey, Martha, if you just give us your first and last name for the record, and then
Martha Tuttle. We have no qualms with McKinsey. They have a good reputation. They have a good track record with doing good work for the agency. So this is not about whether the work is good work. It's not about whether this is a good company. We were asked specifically to look at the contract and see what does the contract say, what kinds of options, is it best practice that you would expect from any other state. The contract is for $15.4 million. It is divided into 4 different major areas of work, each of which has a separate price tag on it, which is all very good. The fact that there's chunks and there's a price tag associated with different chunks of work. It specifies that there are 45 different resources that will be provided from McKinsey, and it lists those by name, so there's a high degree of confidence that the agency knows what resources they actually will be working with. And I suspect that many of those are familiar names to the agency given the track record working with McKinsey. There are performance indicators and consequences if they don't live up to the performance indicators for 4 different areas in the contract. So in our opinion, the pros are McKinsey knows the agency. This allows the agency to move forward with everything that was just mentioned. And the contract does have a termination for convenience clause. So should the agency just decide to change their mind, go in a different direction, rescope this effort, whatever, with a short notice period, they can do that, which is a very good thing to see in the contract. The cons are that it isn't yet clear, because this is building on existing work, how any of this fits with the work that the Stephen Group is doing here. And so that may be something that's an opportunity for a course correction in the future, should that be necessary. The second is the performance indicators are not very quantitative. So they talk a lot more like how you want the work done than they specifically talk about the robustness of the models that they're building, the completeness of the work that they're doing. So it could be a little bit tighter there. The other opportunity to make the contract a little tighter would be to have each of those 4 areas that are specified in the breakdown of the money. They could be separate deliverable payments, or there could be a detailed plan required where within the first couple of weeks of the work with McKinsey, they lay out the plan for the year in a little bit more detail, so you have greater clarification, more shared expectations of exactly what you're going to get for the money that you're spending. So in general, we would recommend a little bit more detail, a little bit more clarity to move this from a high-level agreement to something that's got a lot more teeth that you can enforce legally and contractually if you ever needed to.
And the one thing I'd like to add to that, members, is the payment improvement program that they were tasked under the innovation grant with doing, which is a federal grant, and your state was a model state in terms of obtaining that grant funding right at the beginning of the process nationally. And they've done a really good job designing and getting to that point. One thing I asked, because of some of the stuff we'll share with you later in the data we're looking at, is when you get to the high cost populations, what's the plan going forward? And I've been told by the agency that they plan to go forward, but there's been almost a roadblock stoppage because of some special interests that have been taken into consideration at the higher cost areas. Whether that's a good thing or a bad thing is not for us to decide. The only issue I raise with you is if the original plan was to go full speed into the high cost populations as well with coordination, payment improvement, and then all of a sudden you stop at the lower cost population areas, you know, should this contract be retweaked and re-looked at? And I think the agency is willing to have that discussion as well. So that's all I wanted to add to what Martha has mentioned.
Okay, we've got 5 members on for questions, so I'm going to, well, it just went to 4. Somebody said no, but please, we got a long agenda. I'm going to ask that you keep the questions 1 or 2 and keep it short, and I'm going to start with just one is, having heard what we heard here today, Mr. Stephen and Martha, is it your recommendation that we hold on the contract, that we pass the contract, or that we recommend that the contract be recommended and some attempts to clarify some of the concerns that you have about flexibility?
I recommend you move forward with the contract and use the first 30 days to clarify the details and exercise the option to get out of the contract if that doesn't work, because
okay.
you do have that option.
All right, thank you. Senator Ervin, you're first on the list. You recognize.
Thank you, Mr. Chair. I'm not a member of the task force. I'm the one that made the motion in the review committee to refer this contract for recommendation. The point of me doing what I did was because we've already paid a lot of money for this work to be done. This is an original amount, so it's a new contract for new work. And in the discussion and the dialogue that I think is important here is a lot of different contracts for different types of work, and the coordination of that and the work of the task force. I think it's a purpose of discussion and dialogue to see what road we're going down and if it makes sense to start new contracts and new work, and without having the full, and I understood that we were going to present all of what you presented because there are other sides and there are concerns that need to be presented. at the July 15th meeting. So I'm not here to debate this program. I'm here to simply say, when you're looking at these contracts, and it's not just this contract, it's all the contracts all across the spectrum, and it's the management of all those contracts. I don't want to play for duplication of services in multiple contracts. And this is a problem I see with this is a new contract, new work, when we have been told time and time again we're pushing pause to be able to look at what we have now before we move forward and decide if we're going to continue to spend this money down this path. That's the purpose of bringing this issue to this task force for that discussion. Because just like we did in the special session with an efficiency bill, I think we're spending money on the same thing in different areas, and that's problematic to me. And I also think beyond the work that this task force is doing, is it necessary to start this contract now, or can we start it in January 1? And what are the federal penalties if we decide to cancel the contract? Are they the same as if you don't initiate the contract?
On the federal penalties, I think what we risk is, certainly we risk the additional federal funding that's coming that I think is in the $5 to $10 million range. And we may risk recoupment on previous funding if we in effect say we're not going to follow through on the innovation we committed to. I think if we are able to go to them at some point during the work of the task force, the end of the task force, and say, we'd like to take a different direction with new innovation, I think they'll be very open to that. If we simply stop now, I think they'll take it as, so you're not innovating after all. So that's the risk to us. But I think we're in good shape if we have an alternative plan moving forward. And that may or may not involve McKinsey.
Okay, and when we review this program, are we going to review it from all different angles? I mean, are we going to be able to really review this program and say, here's the pros and here's the cons of this program, which is not what we're here to debate or even present today. We're talking about the contract that we have here as new work, new contract moving forward. I'm not, and I told you on my phone call personally, I was not going to engage with the pros and of payment improvement. That's a different meeting at a different time that I hope we have a full perspective on, not just the agency's perspective on that, but also how it's affecting patients, how it's affecting providers, the regulations that are involved with it, the cost of the bureaucracy for implementation and maintenance of that versus what we're gaining in savings. So that's for another time. The purpose of this is to look at this contract in addition to what we're doing, because I don't want the right hand and the left hand going in two different directions or ignoring what they're doing. And I just see that I don't want to also, because in review committee, the only information I had on this is to provide consulting services in support of this program. And so, you know, that's what I want to hope that we can review to make some determinations before we continue just to march forward, because I want this work with this new consultant group to be meaningful and impactful and not a waste of people's time. So I need to have that assurance and that commitment that we're able to adjust and not realize those penalties, and able to adjust when we're seeing that we're spending money here, but we're also spending money in in-state contract with this group to do kind of the same thing. That's the coordination of contracts I'm concerned about.
Well, Mr. Chair, I think it's a great concern, and I think the commitment you're asking for is reasonable. I mean, our expectation, obviously it's up to the task force, but our expectation is what the Stephen Group is looking at is how the work we're doing now, whether it makes sense, whether we need to change. And I mean, you have our commitment that if the task force, and obviously my boss says, yes, we want to go a different direction, I mean, with 30 days, we can make those changes and go a different direction. So we can commit to that. Okay. I think it's a reasonable request.
Okay. Representative Hammer, you're recognized.
Thank you, Mr. Chair. Could you tell me, Martha, and because you reviewed this as extensively, you've been identified as one that's, you know, sharp on the contracts, what was the McKinsey contract supposed to do under the original terms that necessitates this contract being extended now?
The documentation that I read did not go back through all the history. It just talked about the scope of work, the performance indicators, the expectations for the next calendar year. So I can't really comment. I did not look at the past history to see what's the relationship between the past history. I will say, having looked at many of the agency's contracts in other areas, that the contracting is improving, that every time they're writing a new contract, it's getting a little bit more specific, it's getting a little bit more meat in the contract. So I would expect to see a similar evolution of clarity and detail, but I didn't go back and look at that history.
And have you looked at other areas of the other contracts to, and I think you referenced this, but have you seen specific areas that are overlapped between the McKinsey contract and the other various contracts that we have for consultants, including y'all's, to see if that 15.4 million couldn't be shaved down some because it's already covered under another contract or under another consulting service like yours?
The area of potential overlap with what the Stephen Group is doing is in the area of building the data models and what McKinsey is doing in terms of data modeling. Now, I understand it's a little bit of apples and oranges, that they're coming at it from a different direction. They have a slightly different scope, and I think that that's one of those details that could be ironed out once the Stephen Group report is done. You know, we've got a couple of things going on. We got a timing issue that, you know, the timing is never perfect in this world, and so the need to go ahead and decide whether McKinsey should continue building on what they've done relative to waiting for the Stephen Group report, you've got a couple of months out of sync there. So looking at what McKinsey has done in the past and assuming that that's what they're going to build on, they're more narrowly focusing on some particular aspects of the program versus the Stephen Group was asked to look very, very broadly at the entire program.
Okay, and the time frame of 30 days was referenced. Do you know how much it's going to cost us for the first 30 days at the rates that they are charging? And maybe, John, you want to chime in on this one also. What are the liabilities if we just put this thing on pause for 30 days and work through some of those details, so when we've got it done, we've got a cleaner contract, maybe at a lower cost? And I know we're always under the threat of losing federal funds. We hear that about every committee meeting, but I'm wondering how many, have we ever lost federal funds because we would take a move like that and put the pause button on?
Representative Hammer, I think the risk of pausing for 30 days is McKinsey has a pretty big operation here working on things right now, like I mentioned, like figuring out how to pay the primary care providers. If we stop paying them for 30 days, those, I mean, they're a company that's in pretty high demand. Those people who know our program will go elsewhere. There's a good chance of that. And they, I mean, I'd be surprised if they kind of wait 30 days to see if they're going to be rehired. So I'm afraid we would lose a lot of the talent and knowledge that we have if we just stop the work for 30 days. And not so much, I don't think it'd be so much a risk to the federal money as a risk to our timing, for example, on getting primary care providers paid.
One more, Mr. Chair. So have they completed everything that was under their original contract that they're ready to walk out right now because they've completed everything under the previous contract and those folks won't be here over the next 30 days?
Well, as they do the work, we pay them. In other words, as they complete the deliverables, we pay them. And some of those deliverables, again, just using the patient-centered medical home as an example, it's kind of these stages of work. So they have completed some of the work, and we paid them for that, but we haven't completed finalizing the patient-centered medical home. That would be true on some of the episodes of care also. So yes, what we paid them for is completed, but in some cases, that's not actually the complete work. It's just how much we expected them to get done that quarter.
Did we ever pay them when we shouldn't have paid them, like we've had to deal with other areas because they didn't meet the deliverables? And are we holding anything back from the original contract?
Not to my knowledge. They have. I mean, we just haven't had an issue. They don't send us bills unless they can demonstrate that they've done the work.
All right. Thank you. Thank you, Mr. Chair.
Representative Farrar, you're recognized.
Thank you, Mr. Chair. Mr. Seelig said one total of $42 million on the contract. Then Ms. Tuttle said it was 15.4. Is the 15.4 the extension?
Yes, the $42 million is the federal grant that we got.
Okay.
That is an addition. We get federal money anyway for doing work like this, but then the federal government, in addition to the match they gave us $42 million that we don't have to match. because they know the cost of this innovative work. The $15 million is the extension of the work that we're doing in the McKinsey contract.
Okay, and all the McKinsey contract is working with Episodes of Care?
No, sir, it does work with Episodes of Care, but also patients that are medical homes. We've had them looking at our payment systems on payment integrity. So the payment improvement initiative, Episodes of Care have gotten probably most of the attention because nationally it's the biggest innovation. But actually, in some ways, the more important part to us, I think, now is the patient-centered medical homes and some of the other work. And as Mr. Stevens said, there's some other areas that we've been working on, have not been able to implement yet, that we're still working on.
And you have other companies working on, I think Mr. Hammer asked this, do you have other companies working on those things you just mentioned also?
Well, we have actually, so the short answer is yes, because we have been taking work away from McKinsey and trying to give it more locally and to other companies. So for example, some of the work they were doing, the Arkansas Foundation for Medical Care now does. Some of it is done by Northrop Grumman IT, which actually has state-based employees working for us. The contract is about, for this coming year, is about half of what it was 2 years ago. And our plan is, to kind of continue to reduce by half. We eventually want to use McKinsey as little as we can to the degree we can build up either our own state staff. That's ideal, but it's awfully hard with state positions to fill these. Alternatively, we'll just have to use other contractors, preferably in-state contractors, if the talent is there.
How many contractors are we right now using for this?
For this project?
Yes.
I would guess probably 4 or 5. The reason I'm hesitating, for example, we use Hewlett-Packard for our Medicaid management information system. We've had them as a contractor for a long time now. We have shifted some of this work to them, so it's not a new contract and it's not really specific to this work, but they've picked up some of it. The Foundation for Medical Care we've had contracts with. We've asked them to pick up more of this. So there aren't necessarily new contracts specific to this project. It's some of our seasoned contractors in Arkansas who do good work. We've tried to shift the work to them.
Okay, how much money have we spent on, or have we spent, and how much are we going to spend on what this proposal does?
So the McKinsey contract, we have spent about $85 million over the last 3 or 4 years. With this money and what we'll pay out the rest of this year, I think the total will be about $105 million, which is a huge sum. About 3/4 of that will be federal funding. And just to put it in perspective, that per year comes up to a fraction of 1% of what we spend in Medicaid, which is still real money, but if it has an impact on our Medicaid spending, I would say it's a good investment.
Okay, here's my question. What have we got for $200 million? What have we got?
For the $84 million that we've spent?
85, you said $150 million and 85, or $105 million and 85.
Oh, I'm sorry, we've spent 85, we will spend a total
Of 100.
of 105. Right, so what we have up to now is I would say we are a long ways toward transforming the Arkansas healthcare system. And a lot of what we've done has been picked up by the private sector, by state employees. They're now using some of these Episodes of Care. We have 80% of the eligible Medicaid clients now in medical homes where their primary care physician is getting extra resources to coordinate their care and extra data and information on who they should focus on. So I think we've accomplished a lot.
Okay, can I have a couple more?
One more.
Okay, I have to think which one to ask. Okay, a long question. I want your definition of Episodes of Care, and how many of Episodes of Care have we initially got done?
We've done 14 thus far that we have in place. We have another 5 that are in development now. Our commitment to the federal government is to do another 10, but I would say if this task force and the governor's office decides to go a different direction, that would be one of the things we would go back to the federal government and say we have a different direction to go on. So we haven't started work on those following 10. So between the ones we've implemented and the ones that are in development now, it's about 20.
Okay, about 20. And your definition of Episodes of Care, ICD-9, or ICD-9, ICD-10?
I'm going to defer to Ms. Staley.
So the episodes were originally built using ICD-9, but part of the work that has occurred, which both McKinsey as well as the Arkansas Foundation for Medical Care has been involved in, is translating those to ICD-10. So going forward, all episodes will be built on ICD-10, but there are some that are still using ICD-9 codes.
Well, you know, there's
All right.
over
hey,
100,000 ICD-10 codes.
Let me just say, it wasn't an accident that we started out the meeting by saying the next meeting we have is going to be on payment improvement initiative and episodes of care, because I anticipated we would have this discussion. So, again, we're here to do one thing and just determine whether or not we're going to make a recommendation for council tomorrow. So the episodes of care is an important decision, and it's one that we've kind of kicked down the road to give the Stephen Group time to do some research on it, and even then, they're going to be pressed to give us the data we want on whether or not those are a success or not in July, but they're going to try to make that effort to do so. So we'll have a lengthy discussion to Representative Farrar's question in July about specifics of episodes of care. Do you have anything? Okay. Representative Gray.
Thank you, Mr. Chair. I guess one of the questions I have is if we don't renew this contract, what happens? PCMH still continues, the current episodes of care still continue, we just don't go forward with the other episodes of care, is that correct?
Well, not exactly. If we don't renew this contract, we won't be able to complete the work on PCMH, including making sure we can pay the primary care physicians for the savings they've incurred. We also, part of the work they do now is, our commitment when we developed the episodes of care was, as docs and other providers said, this isn't quite right, you've included a code you shouldn't, you need to adjust this, you're putting too much weight on that we would make those adjustments, that we weren't putting these episodes in stone. Part of the work they're doing now is on the existing episodes, helping us improve those so they really work well for docs. And then the other risk is that that we lose the federal funding and potentially have some recoupment of the federal funds.
Okay, and I know we're gonna do the episodes of care at a future date, but I will say primary care physicians are not taken care of. I think my husband and our clinic made $60 last year on episodes of care, and we were under target on everything. But I guess my last question is, I had heard somewhere earlier that you think that this has saved the state about $1 billion, but I don't have a contract in front of me. I have no data in front of me. I just wanna make sure, you know, it was a big deal with the Stephen Group for a $1 million contract. You know, it was like
Right.
we were spending a ton of money, and here we're about to spend $15.4 million just like that, and I have nothing in front of me to make a recommendation on.
Yes, ma'am, and I guess this is part of kind of when we talk about payment improvement, we can bring more data. And we have presented to the Health Committee and others some of the data on the Medicaid budget and what it looks like now versus where it was going before we started this project. I'd be happy to get with you and give you more detail. We did not bring a lot of budget information today, though. And just to be clear, I would not say that this work by itself saved $1 billion. I think it's been a major contributor to the fact that our growth rate is much lower than it was. But I mean, there are, as you know, there are lots of other factors on when new drugs come on the market, what's happening in the economy, and those all have some impact that's sometimes hard to tease out.
Okay, and then I think I'd also like to see the performance measures. Of course, I don't have those in front of me as well, but they need to be specific just in case, you know, I don't want to write a $4 million check and say go to Hawaii and have fun. I want some performance measures in place that are quantitative that we can hold them accountable for.
Yeah, and Mr. Chair, I mean, the suggestion over the next 30 days for us to tighten them up, we would love Ms. Tuttle's help if there are things we can do, and I'm just sure that McKinsey would be open to us making tighter performance measures. We made a note of that. I think that's a good recommendation if this goes forward.
Okay, and yeah, we'll discuss that at the end. I think that's obviously something that is, you know, we have to think long and hard about pulling the plug on things while we're trying to make assessments, and but we also need to perhaps make sure that the contract is worded to give us the maximum protection possible. Senator Chesterfield, you recognize.
Thank you, Mr. Chair. I was here for one of the committee meetings. I get them all confused. We have so many, dealing with so many issues. And a part of the conversation, Mr. Chair, was that we have so many groups doing evaluations, but let me be clear. What McKinsey is doing is not what the Stephen Group is tasked with doing. Am I correct?
Yes, ma'am.
All right. So if we pull this, we have no evaluation in place as per needed by what we have said we will do going forward. Is that correct?
The McKinsey Group is not doing the evaluation, but we would not have anyone doing the work that we committed to in the meantime. That's right.
Well, there was 35 and 36 in one of the committee meetings. They're all beginning to run together now. And one of them did require evaluation, and we put that one on hold.
Yes, ma'am. That's the Center for Health Improvement is Part
And
of,
the Stephen Group cannot do that work, is that correct?
no,
they're
although,
not.
although I believe
I
what they
mean, they may
find
be
might.
able to do it, but
might
that's not what
inform
they're
it.
tasked with doing right now.
That's right.
That's what I needed to be clear about. Thank you, Mr. Chair.
Senator Sanders, you're recognized.
I'm good.
That's a first right there.
I'm always good.
Senator Rayford, you're recognized.
Thank you very much, Mr. Chairman. And I think after hearing your comments that we may not be able to go into some of this exactly on that contract, but I'll save my questions on that, related to that, for the future. Well, I tell you what, I'm going to take a pass at this time because I think my question is going to lead us back to some other questions. But I will say this, that since our last meeting, I've actually been contacted by some folks that formerly worked at DHS. And I'm going to talk with the chairman and share that information with him, but I want to put you on notice that we're going to have some very pointed questions about not only the contracts in question, but we're going to have questions about who's really monitoring the contracts. And there's a tremendous lack of oversight that I've been told about. And I will tell you right now that I was advised that it was not due to any change in specifications. It's been due to other things. And so with that, I will just be at peace. But I do want the chairman to know and the committee to know that a lot of information has been provided to me that totally came as a result of the reporting in the paper. And so it may be that we can meet in leadership to make sure. I would not want to bring anything forward that's not valid, but perhaps we can sit together and find out, and it may be helpful to you as well. So thank you, Director Seelig.
Okay, and let me just say, and I told Senator Irvin this, who sent this to the task force at the beginning of the meeting, you know, and I think my co-chair mentioned this beforehand, there is some value in us understanding what's going on in the other entities. And I think Senator Chesterfield has talked before about the silos that we have in state government. It seems like we have 4 different entities right now working on health care reform, and not because anyone is trying to compete with the other, but because of the timing of this task force was just created. Well, we already had DHS in the middle of doing some reform. We have the Insurance Marketplace Oversight Board in the middle of doing some reform, and we have obviously the Governor's Council. And I think the point that I would make to those involved, and to particularly those that are signing a $15 million contract, is that at the end of the day, it is what can get 75 votes in the legislature, which is going to be driven by this task force, that moves forward. So it is important that we coordinate those efforts through this task force to ensure that you know, any plan that is presented has a viable chance of success. Dr. Bledsoe, you're recognized.
Thanks, Mr. Chair. I just wanted to ask a general question of you, Mr. Seelig, just to make sure I understand this. I just spoke this morning at the Arkansas Academy of Family Physicians, a lot of primary care doctors from around the state, and this actually came up, the patient-centered medical homes and episodes of care, and I fielded a lot of questions privately after my talk. There's a lot of concern out there about the change, and primary care physicians feel really under the gun, especially in our rural areas. There was feedback, some of the same questions that have been raised here about how the system is working. So obviously I think we need to look at that. But just so I'm understanding everything, the reason that we previously started heading towards episodes of care as a state was because, just like a lot of other states that we have, rising Medicaid expenses, the growth rate was going up and climbing, and a lot of states by default have been going directly into managed care, or hiring an outside group to control the cost or attempt to control the cost. And in Arkansas, we decided not to do that. We preferred to do it a different way, which really hasn't been done anywhere else on a big level, but it was to institute these episodes of care. But the purpose of that was to try to rein in spending, but not go to an outside group doing managed care. Am I correct in that?
Yes, sir, and to rein in spending and to try to give the lead physician or provider more control and more information about what was happening in that episode.
So I definitely think that the questions raised by Senator Irvin and some of the others regarding some of these contracts, that needs to be looked at. And it definitely sounds like communication between the department and some of these primary care doctors, as well as the tracking of a lot of these savings, so that the primary care doctors in their clinics can be reimbursed appropriately and fairly for the savings needs to be looked at. But I just wanted to make sure that I understood why we had gone that direction in the first place, and that seems that that was the case. Is that correct? All right, thank you.
Senator Chesterfield, you recognize.
Oh. Promise it was a mistake.
All right. Senator, Senator Williams, you're recognized.
Thank you, Mr. Chair. Real briefly, in past experience of trying to manage large projects or multiple contracts, we designed a Gantt chart. And the Gantt chart lists all the contracts, and you associate milestones and dollars paid. At the end, all accomplished, zero left to be paid. If this committee, I lose count of all the contracts we've got, and how do we manage those? It would sure help me, and if we were to put those in a Gantt chart form, so when we look at a contract A, and we have 10 milestones, and we expect to pay 10% at each milestone, we as a body can see that. You can see that as a manager. When you put 50 of those out there, I don't know how you keep up with it. And if someone's responsible for each one of those milestones to sign off on, it becomes a little simpler to see who we hold responsible for accepting that milestone and making that payment. So here would be my ask for you. A challenge is to put a report together for this body or for the general legislators, that we can look at all the contracts, see where we're at, how much money's been spent, and did we meet the milestones? And if we did, it becomes a little easier for the ones that are outliers, the ones that are out behind. We're paying too much, we're getting too little. We committed to these and we didn't get them, but we're continuing to pay. We'll need answers, and hopefully you can at least raise our comfort level that as these contracts move on, we're getting what we pay for, we're getting it on time, and we're not ahead or behind on schedule. It's a thought.
Okay, and
Thank you, Mr. Chair.
Yeah, and I think, again, that would fall within the scope of work of what we've asked the Stephen Group to do, and we've had discussions about them reviewing the contracts, and the presentation, as you discussed, would be very helpful. So, in fact, they've already done some of that work, I know. So it is an important part of what we're doing. Is
And if we, Mr. Chair, if that gets on a page, if that gets on a report, we quickly look at 10 or 15. We don't have 10 or 15 pieces of paper out there that somehow loses its way from meeting to meeting. But if we see that, again, as a legislator, it raises my comfort level. All of our contracts are on time. You know, we're meeting all of our, critical dates. And it just seemed like it would raise all of our comfort level that we're headed the right way. Thank you.
Okay, members, that's all we have on the list. And let me just ask Mr. Stephen and Martha to tell me if I characterize what I hear from them as far as their recommendation moving forward, which is that we recommend that this contract continue with the provision that DHS work over the next 30 days to add some refinements and some more clear products of work. You guys can work out the legalese to that, and realizing that we have a 30-day opt-out on this provision. Is that basically summarize what you would suggest and recommend?
Yes, sir, it does.
Okay. Representative Hammer.
Question of the chair, please. Would you educate us? We've heard a 30-day review time frame mentioned in this. I didn't ever hear how much the price was going to be that we're going to be 30 days out, and what was the estimated amount that we're going to be out at the end of 30 days. But if this committee reviews this, it goes before committee tomorrow. Who are you charging with the responsibility to? Are they coming back to this committee in 30 days or at the next meeting, so we can have a real snapshot time of what the progress is made? Because if this is going to be one of those contracts we're, $6-7 million into before we realize it's not what we were told it was, that's a little late. So can you educate us as to the process?
Well, the process is whether we make a recommendation or not, the council will have the authority to review or not review this contract tomorrow. Now, I think obviously a lot of weight would be put into a recommendation either for or against from this task force. So the task force can choose to accept the recommendation of our consultants or to do nothing, or to choose that it not be extended. So that is really the options that we as the task force have to consider here. We
I-
have the option of doing nothing or accepting the recommendation or some different recommendation.
I think with regard to the question of the 30 days out piece, so let's say this goes to ALC tomorrow, Director Seelig, you, and with Martha's help and John's help, work with McKinsey to put in the specificity, the milestones, the objectives, the deliverables, and get those clarified to Arkansas satisfaction, and then update, you can update, and the easiest way to do it may be to lay that out on a piece of paper, and you can distribute it back to us, you can distribute it to ALC. Obviously, we want to be helpful to you if, McKinsey is saying, we refuse to cooperate. You guys are trying to screw us, right? And then we need to opt out, we need to be in a position to do that, right? I think there's a lot of concern somehow that maybe McKinsey won't cooperate, maybe, they're trying to dissemble, and they're not willing to give us, what we need to make this a good contract. So I think, if at the 30-day point we can kind of get some clarity that we've got those pieces in there, I think that would help comfort levels.
Yes, sir.
Let me just add, John, correct me if I'm wrong, this contract doesn't even take effect till July the 1st. And so I think as far as the financial liability of the state, assuming that you get this done the next 30 days, we'd just be talking about 2 or 3 weeks of potential until next time council meets. Because my understanding of what we would do here is we would have an agenda item for our July meeting to have a report whether or not they were successful in getting the assurances and the changes to the contract from McKinsey. If they are, then no further action would be necessary. If not, then the task force would make a recommendation about whether or not we begin to exercise the opt-out provision. Is that basically the recommendation from John, you, and your group?
Both John.
Absolutely. And Representative Hammer, I think what we'll do is work with them to make sure that there's no crossover, come back with sufficient milestones, sufficient performance metrics, and it'll also be part of our report in October, because based on what we're seeing at a high level, which isn't contained in some of the report today too, is that the department needs to really look at all its contract performance measures in total anyways. So this will be very helpful to go through this type of discussion, and I think it would be beneficial to the task force.
Can you get the issues, there were some issues that you felt, or I interpreted you as feeling a little bit uncomfortable with that, would need to be kind of worked through while you're, putting your stamp of approval on moving forward, yet there were some certain areas that you were uncomfortable with. So can you identify those areas and get them to us? It's June 11th today. How quickly can you get those items identified and get them to us as members so we can be watching before the July 1st date?
Within 2 weeks?
We can start working on it today.
Okay. All right. Thank you.
Representative Murdoch, you're recognized.
Thank you. Mr. Seelig, this contract with McKinsey is a part of an overall plan that allowed us to get this funding. It's part of the funding we receive from the federal government. It's something we must do. So with some of what we're talking about doing in terms of opt-out in 30 days or adjusting, you may have mentioned this earlier and I missed it, that's all permissible because you also talked about having to possibly pay money back and those type of things. So I want to be clear as to what we're doing on both sides of the coin if we make such a decision. So can you elaborate on that a little bit?
I think, excuse me, we do have the right to opt out. I think if we opt out of this contract, we will have to demonstrate to the federal government that we have something else in place in terms of innovation. So they know that we're committed, and they would have to agree to it, but in general, I think if it looks like it's worthwhile, and obviously we've worked with the Stephen Group on what that is, I think we'd be okay negotiating with the feds for the funding to continue.
Okay, so going a step further with that, which means to me Plan B, if that happens, what we're talking about. So, do we have relatively reasonable ideas of what we would do next for something of this magnitude? Because it appears, just from a contractual standpoint of cost, that this is of some, it's a pretty high level of work. It's pretty involved, and so as we, I know Senator Irvin's, I think I understand Senator Irvin's reasoning for having us to review this, but as we jump into this and make a decision of review or not, or, advice for someone, I think we have to take all of these things into consideration before we let's balance this and make sure that it's going to make sense in totality.
I think that's right. We would have to have a plan B. Yes, sir.
And that would be pretty soon.
Yes.
So how comfortable do you feel with that?
Well, I think it'd be difficult to come up with a thoughtful plan in 30 days, but I think, again, it partly depends on how fast, I don't mean to put it on, how fast the task force decides which direction it wants to go, and the governor's comfortable with that. I mean, that would then drive whatever the plan B is, I think.
Okay, thank you. Thanks.
Senator Sanders, you're recognized.
Yeah, no, thank you, Mr. Chair. One, I appreciate all the questions on this and the specificity that we're looking at with this particular contract. Two things. One, I think, Mr. Stephen, Ms. Tuttle, I appreciate your work that you're doing on the contract side. Those of us who've sat in a review committee and looked at a number of contracts in the entirety of state government have, we wonder about contract management, for one. One of the things I actually I'd like to make, and two, I'd like to make a motion to provide clarity, and we can discuss the motion. There are two things. One, I would make the motion that the Stephen Group, as they do their work, they not only look at the processes in contract management, but I would also make the motion that you would look at sort of the structural management of contracts and the flow of reporting, and look at recommendations and potential changes of personnel, workflow, and even compensation, and also take a total systems approach to looking at that. I'm sure y'all can handle it. You've probably done this before. Because I think we're going to deal with a number of contracts. I think we've identified something, but there's an underlying policy issue with regard to are we set up today in the best, most efficient manner. So I would move that we request that, and maybe we could we can discuss it, and then maybe we can move, because we have some other contracts that we need to move on to as well. So I think it would. Is that a proper motion, Mr. Chair?
I don't know. It's like the longest motion I've ever heard.
Yeah, so
what is your motion?
Let me boil it down for you.
I mean, we've already confirmed that they are going to review
but
contracts.
I'll be very specific that in addition to looking at contracts practices, that I move that the Stephen Group additionally look at the organizational structure within Medicaid and DHS for the workflow of contracts.
Okay, you've heard the motion. Is there a second? All right, we've got a second. All in favor say aye. Any opposed? All right, the motion's carried. We've got Senator Irvin, and then what I'd like to do is we need to make a motion about what we're going to do on this particular deal that was referred to. So I guess what I would ask Senator Irvin is, given the recommendation that you've heard from the Stephen Group, does this address your concerns? And you can speak to that.
I will, and I appreciate what Senator Sanders just made the motion of. That's the whole point of bringing this here before the task force, because I think there needs to be an overall coordination and look at all the different contracts in Medicaid and the management of those, so that we're not paying for duplication of efforts, duplication of services, or duplication within in-state contracts and out-of-state contracts. So that's pertinent to the work that this task force is supposed to be doing. And I think we also need to look at, specific to this contract, is it necessary, and can we adjust if the task force goes to work and makes some determinations? Can we adjust that, cancel the contract, refine it, shave it down to say, well, the task force decides to do X, Y, and Z. Can we alter that contract to reflect paying for only X, Y, and Z? That's the point of discussion here, and I appreciate the motion. Thank you, Senator Sanders, because that's the point here. It's a matter of discussion, dialogue, coordination, communication. And if you don't have those things, inefficiencies will occur. And so we have to be consistent and well coordinated, particularly in healthcare reform. That's the purpose of your task force. In my opinion, that's what I see that as. So I just wanted to say that, and I'm comfortable with going forward with whatever the task force decides, and I appreciate that motion. Thank you.
Okay, thank you, Senator Sanders. So I guess what I'm saying, we need to, that's the last one on the list, we need to know whether or not there is a motion to accept the recommendation of our consultants that we refer this to council with a recommendation that it be approved, but there also be coordination effort between the Stephen Group and DHS, which will report back to us at our next meeting about the efforts to increase milestones and performance indicators in the contract, but at this point that it proceed forward. Is there such a motion? Motion by Senator Bledsoe. Is there a second?
I'll second it.
All in favor say aye. Opposed? Motion's carried. Okay, next item on the agenda is item E, update of eligibility system and verification. So, Mr. Seelig, go ahead, and this is one of those items that I've asked will remain on the agenda for monthly reports, because I know there's a lot of interest in whether or not this system is working. And so, obviously, we had a report last week that we've not had success yet. So I guess what I'd ask you to do is, and this will be a recurring item, because we need to know whether or not and what the process and progress is on this verification system. So why don't you go ahead, Mr. Seelig, recognize, and we'll hear comments from Mr. Stephen.
Yes, sir, Mr. Chairman, and I'll keep it brief since it's just been a couple of weeks since we last reported on this. I think the redeterminations, which is a big interest to people, will start. We have done about 15,000 now. They will start in earnest. I mentioned that we would be doing about 3,000 per night, and that will start on Monday. We've been, in the last week or two, making sure that we've got the right data. For example, we're trying to reevaluate families together, making sure we've got all the family members together. And we've done just some fixes and worked on some bugs, but that should launch Monday night, and then we'll be doing 3,000 a night. And just to remind you, what we'll do is we'll bounce against the state wage data, and then we will send a notice to each client saying either you're consistent or we've got a concern based on the state wage data. And if we have a concern, you have 10 days to get back to us with additional information. If we don't hear back from you, or if what you send back doesn't meet the standards we need, we will then turn you off from the Medicaid system. We should, by the July meeting of this committee, I mean, depending on when in July, have some pretty good preliminary data for you. We are starting with those between 100 and 138% of poverty who are on the independence program, who are on the private option, kind of the highest income people, and then we'll work our way down, and we're also doing other members of the Medicaid program. So that's on track to start. We also have, as I mentioned, we've talked before, we've had some concerns about the underlying software, the IBM software called Curum. They have had a team on the ground at no expense to us for the last month or so, and we're also holding a $1.3 million of payments to them. And yesterday, with DIS, Department of Information Systems, we had a meeting with IBM to hear their plans to rectify the situation, and we're going to be trying to pin them down on more details in the future. But we do seem to be making some progress there, and again, they have committed to 3 months of work at no cost to us because they realize there have been some issues with it. And finally, I'd mentioned that through a review committee yesterday or the day before, Medicaid will be paying the Department of Information Systems. They will use the Gartner Group, which is kind of nationally recognized at evaluating projects like this, to do an independent evaluation of this entire effort. In particular, focused on is the underlying software, this Curum IBM software, what we need in Arkansas for the future. And if there are weaknesses in it, is there a better product out there? What would it cost to move to that? And basically make recommendations back to DIS, back to the governor, ultimately to the legislature, as to whether the direction we're headed in, given the issues we've had, whether we should continue where we're going, because we are making some progress, or whether ultimately this is a system that we need to move away from because there's a better product out there. And that review that Information Systems is doing with these consultants, I believe, is scheduled to last 12 to 14 weeks. So about 3 months from now, they'll come back with a recommendation to the legislature, to us, to the governor, as to whether we should stay on the same path or go a different direction.
So, are you saying that there's the possibility that we're going to abandon where we are right now on the eligibility verification?
There's a possibility. If they come back and they say, and Information System, Governor's Office agrees with it, that there's actually a better product out there that will cost less and be more stable, more sustainable, I mean, we want to work with whatever product in the long term is the best product for us. As you'll recall, at the time sorry, a little bit long answer. At the time we started this procurement, there were really, my understanding is really 2 software products out there. There was this Curum product, and then there was a product, I believe Oracle product, that were out there to choose from. Oracle product is the one that Oregon used, and they had a complete failure. But if this, for example, this company comes back, Gartner, comes back and says the Oracle product is now better, or there's a new product out there that's even better, and maybe Ms. Tuttle will be able to weigh in on that. I mean, we want to know what's going to work best in the long term. So I think the short answer is yes. I don't know that it's likely.
If they do that, if you were to say that now we've got a better answer, would that mean the $100 million we've spent so far is wasted?
I don't think so. I mean, that's, again, I don't want to speak for them. I think there are a number of options. One, you could just start with a new product, and that would be part of the question is what would it cost to shift? The other would be to take the work that's done now, use a new vendor to build on that with a new product. I think what Utah has done is they started with the Curum product and decided to build out itself rather than continue to use the upgrades from IBM. So those are at least 3 options that I've been told by the Department of Information Systems are out there. So it wouldn't necessarily be that we would toss what we have. That's what the Gartner Group.
But it could be.
Yes, if that's what they came back and recommended. I'd be surprised because I'd have the same question you have, which is what would it cost to start over? And you couldn't start over and just stop what you have because you've got to continue to do eligibility in the meantime.
So 2 questions. One is you said that we will be doing 3,000 per night.
Right.
What day? What day will that start?
It should start Monday night.
So next week on Monday night, you're going to have 3,000.
Yes, sir.
And so up to this point, we still have not, the system has still not identified anybody for removal. And Monday night will be the first run of 3,000, and by the next task force meeting, you'll be able to report what the percentage of those that have been determined ineligible is, and you'll be doing 3,000 a night between Monday and then.
Yes, sir. Assuming the next task force meeting is about a month from now, we should have had time to go through the 10-day process where we send the notice out and hear back. I mean, obviously, if the next task force meeting is 8 days from now, we won't have that data. But yes, sir, about a month from now, we should have good preliminary data on the first few thousand that we've done.
And IBM is recognized to the point that they're giving you 3 months of free service because they acknowledge it's screwed up?
Yes, sir. Of course, they don't acknowledge that it's all their fault, and there are things that we've done and that the federal government has done, but they realize that their product is not working like it was expected to.
Okay. Representative Meeks, you're recognized.
Thank you, Mr. Chair. A couple questions here. I'm Gartner. Is it Gardner or just, I want to make sure.
I believe it's Gartner.
Okay, so I wrote that down right. How much is this independent review costing us?
$400,000 and change. I don't know the exact amount. I don't have it in front of me, but it's in the $400,000 to $500,000 range.
And you said that it was going to be 12 to 14 weeks, and we would get some kind of recommendation back. Is that correct?
Yes, sir.
Okay. And this is the $100 million system that we've been talking about. We're finally going to see it go online on Monday. That we hope.
Well, it's been online. I mean, it's the system that allowed us January 1 of 2014 to start taking applications for both Medicaid and for the expansion program. So it's been online. It doesn't do everything we need, and one of the pieces that's been difficult to get in place is this redetermination process that'll start in earnest on Monday.
Okay,
so I mean, compared to, for example, healthcare.gov at the federal, which basically failed, or the Oregon system, which never even came up, our system does work. It just doesn't work like we want it to, and it still needs significant components.
And that was kind of the whole contention that we had, is that we kind of got mixed signals about what was working and what wasn't working. So can you break down, in general, for $100 million, what was working, and then, I'm guessing the only thing that really didn't work that we wanted it to work was the verification system, but if there was something else that I've missed, could you let me know?
Yes, I'm going to do this from memory, but the first thing we had to do was stand up the system to take eligibles, so that people could apply to the system. But then there were a number of components, for example, the ability to, when healthcare.gov got applications, they were supposed to send them to us after they determined eligibility, or if we got an application that looked like it was not one of our clients, we had to send that to healthcare.gov. There are a number of rules and requirements that we had to gradually build in place. One of the big ones, and then another huge one, was what's called change of circumstance. You've gotten a job, you've had a death in the family, you've gotten on, being able to shift people out of the program or elsewhere in the program. So that was a major undertaking in the second year, and that is now completed. The next big piece was this re-verification or redetermination process that will start on Monday. And then there is the issue of, from the systems we had for the SNAP, the food stamp clients, Medicaid, being able to transfer those clients into this new Curum system and have SNAP and Medicaid talk to each other so that we didn't have different data for the same family in different systems. Some of that work is still going on. A lot of the transfers are happening, but the SNAP component is not up yet. And then the old Medicaid system, traditional Medicaid categories, you still have to build that piece of it. That has not been done. The focus initially has been on these MAGI, kind of the new federal requirements. So that traditional Medicaid piece, that piece we put off because we want to put out, the governor asked us not to do anything now that we didn't have to do. So we're going to put that off and put that out for bid under an RFP so we can have more controls. So those are kind of the big components of it. So there's still significant work to be done. Probably the hardest work in some ways has been done to stand up the MAGI component, but there's just a lot of work left to do.
Can I, and this is the last question, is I would like to get, and I probably should have requested this a couple weeks ago, but can I get a timeline of the system, what went online, when,
Sure.
and what we're still waiting to go online as far as the components are concerned, so that I can, I guess, get a picture of the timeline about, okay, this is what we spent, this is what we're getting so far, but this is what we're still waiting to happen. So,
Yes,
thank
sir.
you, Mr. Chair.
Yep. Senator Rayford, you recognize.
Thank you, Mr. Chairman. Well, we've kind of segued back into some of my concerns. So I think I have a couple questions for you, Director Seelig. And on this issue, again, it's now we're back on the issue that was discussed, I guess, the last meeting that we had.
Right.
You had stated that some of the reasons that there were problems with specifications had been changed.
Yes, sir.
By the federal government.
Yes, sir.
Would you mind producing for me a document that shows me what specifications they actually changed?
Yes, sir.
Because that would be helpful, so I appreciate that. Do you happen to remember any of the change requests that they asked of you that you could bring before us?
Yes, I can't, I don't know that I can give you the technical details, but for example, the way that they were sending clients to us, they changed the way they were sending that. That caused us to rewrite our software in order to accept those, I mean, just as an example. But there are, I believe, 980 rules that they put out as we've been developing this on how the system's going to work. But I can get you a list, a summary of what those changes are.
And I want to make sure I heard correctly just earlier. Did you say that you're now even looking at possibly not going forward with this whole model that has been discussed?
Yeah, what the governor has asked, and I think at the recommendation of Information Systems, Department of Information Systems, is that we get an outside review of the entire system and say, are we headed on the right path, just to make sure that this is the right investment, that we've got the right tools in place.
Well, I just, and I'm going to close, I'm not going to even go to the other question, but Mr. Chairman, and I'm going to use I think I'll use an analogy and try not to make everybody mad in using it. But we had recently a public servant who had done some things they shouldn't have done, took some money they shouldn't have taken, and that's already been taken care of. But that particular person that was held accountable for what they did personally, they didn't lose $100 million of taxpayer funds. But we are nearly at the point where it seems that that's almost the way it feels here. And we did lose $32 million, which was the contract you said that $32 million was paid and they were fired. And so I want to emphasize how important and critical this is to us. And I'd ask you the other day if you would just help us figure out what the problem is, because somebody didn't do their job. And I feel like that it's the only right thing to do is be accountable here. And we want this to be fixed, we want it to be done right. But you know what? We don't want the same people that were managing this that lost the $32 million and we're now tracking towards $100 million to be the same people that's watching it now. And some of the people that have contacted me, I had never known these people before, but they used to work over there. And they said when they asked the proper questions, they were booted out. And they told me that one of the biggest problems is that the vendors that you have coming in, you have nobody on your team that knows what to even ask and to do and how to monitor that situation. And so they basically describe this to me as vendors that go around the nation, and when you fire one vendor, then the next one of their buddies picks up and carries on, and it continues this process over and over and over. And so you're here sitting in front of us saying, we've spent $100 million, we still don't have it fixed. They pretty much laid it out in pretty plain detail for me. So I'm just telling you, we've got to get some answers to this.
I think, again, if we're going to get into personnel issues and so on, we got another committee for that. Representative Farrar, you're recognized.
Thank you, Mr. Chair. Can you step me through the process of how they're going to do the verification that you're starting Monday?
Yes, sir. We take the data that we take those individuals and we bounce them against the state wage data at the Department of Workforce Services to look at, I believe it's quarterly wage data that they have. If that, and I may have to get somebody up here for more details, but if that wage that we're looking at is significantly different from what they have reported or that we have on record, we then contact them and say.
How do you contact them? How are you going to contact them?
We will send them by mail. We'll send them a letter to the address that we have and say, we seem to have a discrepancy here. You've got 10 days to give us information such as check stubs or something where they've been terminated, where they've got a letter, some additional information that would show that our initial review was incorrect. And if we don't get that back in 10 days, we begin to terminate their eligibility.
Okay, so you begin to terminate. You just don't automatically shut them off.
Well, in effect, we do, and send them a notice that they're being shut off. Now, if we weren't able to contact them and we had a phone number, I mean, we would, we'd say to our worker, you need to try to make the phone call. We obviously don't want to shut people off who are eligible, but we terminate them. If they don't have the information to us in 10 days, we terminate them unless we have a good reason not to.
So, okay, when you mean termination, they're off the rolls?
Yes, sir.
Okay, and that's if they don't answer back in 10 days, they are off the rolls?
Yes, sir, and that's not just on the private option, that's on regular Medicaid also.
Okay. Okay, thank you.
Okay.
Senator Sanders, you're recognized.
Thank you, Mr. Chair. I won't make the motion again, but I think this is an example of what, from a structural standpoint, and we all know the failings on this project. It's, and Mr. Selig's right. When we initially stood it up, it worked well while everyone else was failing and trying to do the change in life circumstances, and the redeterminations have been the bedeviling problem is this. It was mishandled from the get-go, from the procurement side, and procuring a large IT project on time and material breaks every rule in the book. You incentivize the players to do what? Time and material. More time, more material. Secondly, there was no single point of responsibility. The fact of the matter is, every state in the union deals with the fact that we do not have the professional resources in place because we can't compete largely with the private sector in terms of management of complex IT projects. That's why you have to hire out. But I do think there are some things that we can do to do a better job. This one, if you wanted to create something to fail, this is the model that you would follow. Mr. Selig, you acknowledged that on several instances. We've been meeting on this for about 16 months now. And I appreciate the fact that there's recognition that putting someone within DHS as the project manager that doesn't have the capability, the knowledge, and the know-how to manage it, and the fact that because we procured it as a time and material basis and we weren't able to have performance measures in place, that didn't work. It just didn't work. Mr. Stephen, Ms. Tuttle, and Ms. Shealy, I know you're working on this too, even internally, because the governor wants answers. There needs to be structural fixes. There need to be new processes in place. There needs to be protocols for how we procure large IT projects. I know DIS now has the authority to, if there is a major IT project, it's going to them for review. There's statements of work that have to be reviewed. This ain't easy. I mean, this is not easy. These IT projects are tough. States struggle, federal government struggles, private sector even struggles with procuring these. And I do, one of the things that you did say, and Senator Rayford asked the question, was the changes that the feds were putting down at us. I do know that some of those changes they were requesting actually violate Arkansas law even, so there are some things that that y'all have been working through with the feds. I'm not trying to absolve you of any responsibility here. I think you've accepted responsibility for the failure. I think now what we need to do is make sure we understand it, but then make sure we are fixing that. But again, members, this is just an utter failing of project management. We broke rules of project management 101, and it started with the procurement. So Mr. Stephen and Ms. Tuttle, I hope we'll do sort of a debrief, a backwards debrief on that, and it'd be pretty easy. But again, looking at what do we need to have an efficient, optimum organization to manage contracts, not just IT, but others.
Mr. Chairman, if I can just quickly, first let me acknowledge that. I mean, we have not managed this project well, and I'll just tell you, unfortunately, I've terminated many employees when they don't do the work they're supposed to do or misappropriate funds. In this case, we did not manage this project well. I think in part, we did not put the right resources to it. And again, I have said, you know, part of it was I was trying to save money. We didn't manage it well. We put a lot of controls in place. But I think the people working on it have been working very hard. In some cases, as Senator Sanders said, we asked them to do management or do it as an additional job that they weren't capable of doing. It was just too much. And we have now put a lot of changes in place, working with the governor's office, working with information systems. But I mean, if I find somebody who's kind of intentionally done something wrong, Senator, I've terminated many people in my time, and I don't stand for it, but that's why I take responsibility, because ultimately it would have been up to me to say, we've got to go a different direction, we've got to spend more money to get more oversight. And clearly, in hindsight, we should have done that. We should have hired a systems integrator sooner. I didn't want to do it because I thought our staff could handle it, and we were already spending a lot of money, but in hindsight, I mean, that's a failure on my part. The staff working on it, I think we're working very hard. So I guess that's the distinction I would make. But I am not, I mean, we have not managed this project well. I think we now have in place a number of improvements, and I think the Stephen Group will probably give us some additional ideas. I would also say and I don't think this is just DHS, we don't do a good job of procurement in state government. It's hard to do it well. It's hard to write good performance standards, and we would love more technical, and that's not to say any other state agency. I mean, I'd love to have more capacity, more expertise in my agency of people who know about procurement, but also more training available on how to do this well, because we didn't handle this one well. And I think, as you all have said, there's issues, you know, many places where we just don't have contracts as well written as we should. So I'm very open to anything we can do to improve this process.
Mr. Seelig, would you not agree that the idea that this item is going to continue to be on the task force agenda and discussed publicly is going to increase the likelihood that it's going to get fixed?
Yes, sir.
And I guess that's what I think is important for us as members to understand is our job is to identify problems and then identify solutions. And that's what we expect, obviously, the administration and our consultants and others to help us do here. Because it's clear you've acknowledged, the members have acknowledged, we have identified a failure in process and in oversight of this verification system, and it's been a very expensive failure. Now the next challenge is it's easy to identify problems sometimes. It's more difficult to identify solutions, and that's what we'll continue to discuss. And we're going to hear from Mr. In fact, we've got a couple more on the list. What I'd like to do is before we finish up this list, because this may generate some more questions, is ask Mr. Stephen and Marcia if you'd like to weigh in on what you have seen and the progress and suggestions you might have about how we fix this.
Absolutely. Thank you, Mr. Chairman, and Representative or Senator Sanders. I won't make that mistake again. I think you really nailed it, and it's one of the initial things I saw in my own experience early on meeting with the department, that there needs to be some better management in the whole procurement, contracting, and vendor management, centralized, coordinated. It's stuff that we're going to raise in our final report, And because it'll end up having savings in the long run that you can use to help those in need. And so that's what we're trying to help them with. What I want to make sure for process is to just let everyone know before I hand it off to Martha. And Martha actually has been working in Florida, Department of Children and Families, large departments, helping the secretaries when Deloitte comes in and looks for change orders to identify these types of issues. Also in Texas on our team, helping Texas with major SACWIS child welfare development projects with IT related. So her analysis, rationale, and conclusions are going to be really important for us. But I want to go back to Representative Farrar. You mentioned earlier about the timing. I apologize, but we've been under the gun to try to get all the interviews we can for the first month. We started on the 16th. This isn't even the first month. We met with so many people. I was up last night typing to make sure I get you guys what you needed. I want to just tell you the next monthly status update, you will have time to read it. I know you probably haven't had time to review it, but if you just look at what we've given you, the status report at page 20, we have a section on eligibility and enrollment framework. And if you look at page 20 all the way to page 23, we go into some of our preliminary observations on procurement at the department as well, to provide you with a background and thoughts and identification of some of the issues we're seeing. So it's really important that this is just a status update, but this has the details you can take home with you and look at. As far as the appendix, and this might be something that is real helpful to the committee, at page 26, actually 20, I think 26, we start with the entire list of the professional services contracts at the department. These aren't the technical service contracts, but these are the professional service contracts, direct or indirect care. There's a number of pages, and it goes till about page 30. I think it's 26 all the way to possibly even 35. You're going to see a total of over $300-some-odd million in contracts. The contractor, we've given you the list, the amount, and we are going to start digging. And one thing Martha and our team has requested is the top 25 contracts, that we can actually start looking at the background and to identify for you some of the things that we're seeing. The final thing is, in the actual status update, there are issues and concerns. And if you look at our issues and concerns, which is on page 25, there are a few of them. So right off the bat in this month update, we've identified some issues and concern. And one of the top issues you'll see in the beginning is the absence of a true system integrator and the eligibility system. In the second paragraph, clearly we feel there's still a troubled situation. And I'll let Martha discuss what she has observed in her expertise. But I think you've got enough information to really begin to start asking the right questions as you go forward. And we'll continue, Mr. Chairman, to really dig in this area, because it is a big area, along with all the additional contracts that we've seen that need to have this type of review.
Let me start with a little bit of the procurement history. And I'm sure you've heard some of this, but just to recap it from an outsider point of view. So a number of issues started way back in the beginning. It's important to get a sufficient level of detail in your initial request for proposal, because the more detail you can give a vendor, the more you can hold their feet to the fire that this is what you asked for versus this is what you got. Partly because the feds didn't specify all the detail, that wound up, you started out from a very vague position of it wasn't real clear every last detail of what you wanted. You went through a competitive procurement process. One of the first things that jumped to my mind was the fact that you had a 4-month negotiation period with the vendor that you selected. That's fairly long in terms of other states. And what that says is you must be negotiating a lot of stuff, as opposed to the RFP practically being the signed contract with a week or two of things to talk about, debate, and then go ahead and sign that contract. So you had an opportunity there for negotiations to crater, and that's exactly what happened. Negotiations fell apart for a variety of reasons, and that first choice vendor basically would not agree to what the state wanted, and everybody parted ways. The next big problem was you were not allowed, because of procurement regulation, to go to your second choice vendor. That's a huge problem. And it's, when I've asked different agency people, if that happened again today, has that legislation been changed so that you would be allowed to go to your second choice vendor? And the answer is unclear. So I'm not an attorney. I won't attempt to interpret the current version of the statute.
Is that your understanding of the regulation and law, Mr. Seelig?
I would have to defer to the Office of State Procurement or our procurement people. I don't know it personally that well.
That's one of the things that we'll ask for further information if you can get with our legal folks and find out, because some of these things, if we can change with regulation, it's pretty easy.
Yeah.
I would say, Mr. Chairman, I mean, my understanding is normally you can go to the second. There was something about this procurement, maybe the length of time or material that had been sent, that caused, in this case, we were told we couldn't. But I think in general, we can go to number two if number one
We'll get some
fails.
clarity on that.
It seems to depend on whether this was considered a best and final offer. So there was some issue about whether this was a best and final offer or not, and therefore you couldn't go to the second choice. So as a result, you couldn't go to your second choice, which meant in both your first and second choice, you would have had a system integrator. But because of the technicalities that the agency got caught up in, for whatever reason, you couldn't do that. So here you are, you've got a looming federal deadline ahead of you, you need to get the work started, you had to go to something. So these contracts, not only were they time and materials staff augmentation contracts, they were actually piggybacking on a state of Pennsylvania contract that they had with these vendors that had a clause in there saying any other state can piggyback on our contract. So these weren't even Arkansas-based contracts. It wasn't something that you had another agency here in the state that you had a good track record with these vendors and said, all right, I'll piggyback on something another agency had. You had to go piggyback on another state. So the vendors that you wound up with, the one that's been terminated, EngagePoint, proposed that they would have 8 full-time people and 9 part-time people on the project. In 2011, EngagePoint, according to their own website, had 106 employees. By 2012, they had grown to 150 employees, and they had also won contracts in both Maryland and Minnesota. By 2013, they had grown to 258 employees and won contracts in Arkansas, Hawaii, and Missouri. I would say they were stretched a little thin. That they must have been a great sales organization, but did they have the delivery capability when in 2011 they only had 100 employees and you were counting on practically 20 of them? I just don't think they had the delivery experience to follow through on what they were promising. And clearly they were promising a lot because they had 5 states say, yep, you're the one we want to work with. So I think it just started that you were on such a weak foundation to begin with. Contractually, the size of the companies, the level of expertise they had in the area, and the lack of a systems integrator. Now, why does a systems integrator matter? I like to use the analogy of renovating an old house is a lot like these systems projects. That we got a 100-year-old house, and whether you've done that personally or you've watched those TV shows that talk about it, typically when you rip up the floorboards or you start taking down some drywall, that's your first, oh boy, we got a problem moment. And suddenly you've got a surprise, you've got an issue to work out. The systems integrator plays the role of that sort of general contractor on the ground who is going to figure out the solution. Who is going to figure out, are we going to move the plumbing? Are we going to move the wiring? Are we going to relocate the window? What are we going to do to somehow work around whatever mess we just uncovered? And that's what was missing, was that sort of on-the-ground traffic cop that is able to figure out the solution and to weigh the different costs of different workarounds. So you want that general contractor, if you're the one renovating that house, and you've got a $50,000 budget for the renovation, you want that contractor to propose ideas to you of, if we've got a $2,000 surprise, what can we do to save $2,000 someplace else? And you didn't have anybody helping you do that. And you couple that with the fact that the state employees hadn't done this before. The largest project that most of them had been on before was a $7 million project. So they didn't have the expertise to scale up and do something of this size and complexity. So you kind of had this perfect storm of problems. You compound that with the Curum software. The Curum software has been in litigation from multiple states. I would say every state who has put it in has not been happy with it. It has not been everything that IBM promised it would be. IBM has successfully won all the lawsuits, but I would say that's only because most of the other state contracts were weak. So the fact that they won the lawsuit doesn't mean they have a great product. They have a fairly poor product that they oversold and underdelivered. So the problem is that was the foundation. You know, that software product was kind of like your architect's blueprint in our renovation analogy. And if the blueprint's wrong, and the architect thought you could do this, or thought this is where the HVAC pipes were, and that wasn't really true, then the fundamental assumptions that you've made are constantly being challenged and questioned. And that allows all these vendors to finger point at each other. Well, the cost overrun's not my fault, it's somebody else's fault. So you didn't have enough of a stable foundation for you to then hold the vendor's feet to the fire and say, you can't charge me more money, you have to do this for the price that you originally quoted me. So the contracting, the lack of detail, all of the sort of fundamentals of being able to run a very, very tight project that has no cost overrun are just not there. And the problem is, you still have a lot of these original contracts. So for finishing the Magi work, you still have basically a slightly improved version of the original contract. Things are getting better. You're moving in a better direction, but it's not a great foundation. It's not the contract that you would want to enter into today, knowing that this project is the size that it is. So I think that's kind of important history of how did we get here.
I appreciate that. That's good information, and that's straight talk, which is what we have to have. Senator Sanders, did you have a follow-up to that?
Yeah, and add to this if you want. I mean, considering the fact that, you know, this is probably one of the most bedeviling IT projects from a federal level. You talked about the fact that there was very little specificity from the feds, but I mean, you're talking about because we're a determination state, we have to interact with healthcare.gov. I'm sure you've reviewed some of those flat files and you've probably seen them in other states. It's a jumbled mess. I mean, so you're trying to make sense of that. Adding to that, and you'll probably get there, is the fact that we didn't have people who could recognize the problems. We had the 7 or 8 tails, i.e. the vendors were wagging the dog.
Before lunch, okay, so let's go to the question, please.
I'm recapturing the balance of my time from the earlier. But I mean, I mean, again, so you have Minnesota, other states that use that Curum product. I mean, how different is this early experience from what they dealt with, from your knowledge?
I think everyone has had trouble with the Curum product.
I'm talking specific to, so again, we wanted to build the bad ship. I mean, we ripped down the walls and there was asbestos all over the place. So, I mean, so how many other states, you know, mishandled it from the get-go, or any other states mishandled it from the get-go?
Well, I would say most states have had major cost overruns, and the feds have declared that no state has the capability to be the system integrator. They have now seen this pattern, recognized this pattern, that the expertise is just not there for the states to play that role. That's interesting for them to figure out now. A little late to be helpful for us on the money that's been spent. Now, in terms of the go forward, on the traditional Medicaid, the department intends to go forward, issue an RFP, and try to get on a better footing going forward. So there's the ancient history for the work that has not really been started in the traditional Medicaid area. The idea is go out for RFP, hire the skills that you need to hire, make it a much tighter contract, provide the requirements in more detail so that you have the specificity that you need, and try to do that in a different fashion. And that process, the requirements are being updated, the RFP is being written now with an anticipation that that work could start potentially as early as July of next year, with the caveat that some of the steps in your procurement process are quite lengthy compared to some other states, so the timelines are a challenge.
Okay. Thank you. We've got Representative Hammer and then Senator Raper. Representative Hammer, you're recognized.
Thank you, Mr. Chair. John, this question is for you. When we go live on Monday night and we start adding 3,000, the determination that they are actually eligible, if in the event we find out that they're not, at what point do we stop paying the premiums on them? And then the second backside of that question is, prior to, how much in premiums have we paid once we identified that people were not eligible prior to Monday night when we go live? Can you?
Yes, I think the second part I'm not sure. The first part is, if we determine, today's June 10th, I think, if we determine, if we do it tonight, tomorrow we will actually send out these notices. It's kind of automated system that will send out these letters. And if you're one of those people getting that letter, you would have, we might give a couple days for the mail to get there, but you'd have till the 20th or 22nd to have something back to us. If we don't get it back, don't hear from you, or what you send back is not helpful, we would terminate you and not pay we pay the premium at the beginning of the month, so we would not pay the premium for the next month. I mean, it's as immediate as we can do it.
What about prior to June 10th, retrospective, looking back, how much have we paid in premiums for those that were determined not to be eligible once we did?
Yeah, as it is, we don't have an ability to go backwards, because what we're looking at is whatever's currently in the state wage data. So we don't know from that data, how far back that goes. Now, the federal government might determine it by looking at their tax records through the IRS data. We've decided to use the state wage data because IRS is, as you know, even further back in terms of when at least the state wage data is quarterly, if not sooner, more quickly than that. So we think that's better data for us to use.
And then if somebody is terminated and they go to the hospital after they have been officially terminated, and in that letter, I guess it was going to say, if you don't respond 10 days, you're terminated. So for all practical purposes, we're not liable to pay for anything after the 10th. Do you have any projections based on the past then as to how many might receive services and that not be compensated, or how will they be compensated?
So there are two different components here. In the case of the independence program, the private option, where we're actually paying a premium, that premium's been paid for June. So if they go to the hospital in June, they're still covered. Their insurance has already been paid. After June, they wouldn't be covered. In the case of Medicaid, if they're on a regular Medicaid program, we send them a termination letter. That termination is kind of as of that date. So then if they go to the hospital later in June, they would not be covered. We would turn off their Medicaid card effectively, and when the hospital called it up, they would see that they've been terminated. Now, I'm going to turn around here and make sure I'm saying this correctly. See if anybody in my staff. I'm getting head nods. I think I've been correct in the way I described that to you.
Okay, and that applies to all services, including the ER then?
Yes, sir.
Emergency room?
Yeah, no, you're either on Medicaid or you're off.
Okay. Let me stop right there, Mr. Chair.
Senator Raper, you're recognized.
Thank you, Mr. Chairman. And I do really appreciate the history that you were given, ma'am. It's very helpful because a lot of the information that was coming to me actually was related to some of those issues. I want to make sure, because a lot of this is all interrelated, frankly, with the exchanges, obviously, et cetera. Director Seelig, was there a point in about February of this year, because I'm trying to get a handle on how deep this situation, how serious it is. Did CMS threaten to actually just say, okay, we're done with the problems and Arkansas just needs to go to the federal exchange? Did that happen during about February of this year?
Senator, I don't recall them saying we should go to the federal exchange, but they were concerned where we were and asked us basically for corrective actions. Because they were concerned that we didn't have, for example, with the systems integrator, they said you've got to have one, or we're not going to continue to support this project. So
Was one of their corrective actions basically to say, if you don't fix this, we're going to ask Arkansas for $125 million back that we've given you?
I don't recall that, Senator. I can go back and look, but I don't recall them ever saying we're going to take the money back. The focus, to my knowledge, the calls that I were on was, we got to get this fixed. We've got to have a plan to go forward that we're comfortable with.
Okay, thank you.
Senator Sanders, you're recognized.
Sorry, Senator Chesterfield. No, and to my colleague, Jason, Senator Raper, and I don't want anybody to mistake Mr. Seelig's parsing of words. I mean, a lot of times when people say I don't recall, I mean, some people think there's obfuscation going on. That never happened. They never threatened to pull. They never gave a directive to go to the federal exchange. I had conference calls with the lead CMS, Jess Kahn at CMS, who's head of IT. I think what they're worried about is the outcome they want states to function. I can tell you that y'all really get a kick out of this, but this has happened on a couple occasions. When the federal government and the federal folks are telling you things that, hey, you need to do this to save money, you think, well, my goodness, what kind of message are they delivering? I will say that their primary focus and what they want is a system to work. I do not have faith that this system can work both, long term, because there's maintenance. And I think this is the great thing that the Gartner Group is going to do is like, not only what is it going to cost to get it operational, but what's it going to be like in 2 years. The fact of the matter is we have one eligibility system, and that a lot of folks have to interact with. And I hope that one of the things that they're going to look at, we've got workforce services that has eligibility responsibilities. We have the exchange will have some responsibility. DHS, we've talked about the non-MAG, the SNAP, all those other things. This is very important. But to be very clear, the feds did not come. They do a lot of things wrong. They did not come in at any time and threaten to take away, that I know of, any of the funding or recommend that we move to the federal system.
All right, Task Force, here's what we're going to do. We're going to break for lunch. We've still got several items on the agenda for this afternoon. So we're going to pick back up with agenda item F, and we're going to come back at 1:30. And given that we've got some presentations in here, our expectation is it's probably going to be a couple more hours this afternoon. So look forward to seeing everybody back at 1:30, and we'll pick up with item F. Thank you.